We're hearing from our seniors that they want to remain in their homes. They wish to live at home as long as possible and delay as much as possible a move into assisted living or a residential care facility. They want to remain in their familiar surroundings with their pets, belongings, their memories. Fraser Health is redesigning its home health services in recognition of the fact that the population is aging and that our hospitals, both wards and emergency departments, are very congested. We also know that our senior patients take longer to recover following a stay in the hospital, and that we need to support them after discharge so that they can continue to recover in their own homes. And that is the basis of our Home is Best philosophy. Being in hospital is difficult for anyone, but it's particularly difficult for our seniors. We know that with bed rest, they lose muscle strength at a rate of 5% per day. With changes in their blood oxygen levels, they can become easily confused, and with just the unfamiliar surroundings, they can become unsteady on their feet and be at risk for falls.
Oh, hi Eva. Eva, we just came to check if your nebulizer is finished.
So returning home as soon as the medical condition is stable with proper home supports and community services gives our seniors the best chance to regain their strength and to return to a life of independence in the community.
My name is Alan Duggan, and I'm 81 years old, and I'm living at home because I prefer to living in a residential area. My family is here. I feel that I'm happier with them around me, and I don't feel bad at all in any way with living at home.
Unfortunately, he had a stroke, which wasn't a normal stroke. It was a brain hemorrhage on the 15th of August of the year 2000. Since then, he's been in and out of hospital. After he had the brain hemorrhage, he was in hospital for 3 months. And at that time, they wanted him to go to a nursing home. And I said no, he had to come home with me. And I'm sure that if he hadn't come home with me, he would have died because he would have just given up. Good morning, Donna.
Hi, Mrs. Duggan.
When we discharge our senior patients and they're not completely independent, and we know they need some supports, we don't rely just on family to provide that care. Home Health can provide home supports using our community health workers to provide assistance with things like grooming, personal care, bathing, and managing medications. They can also help connect seniors back into the community with their friends or family members and other community resources.
That's good. Let's bend this knee up. Bend it up, bend it up, bend it up. Wonderful. And straight. Bend it up again.
Following surgery or prolonged hospitalization, we can provide short-term physiotherapy at home, as well as occupational therapy assessments to ensure safety in the home. We can also provide nursing support, either in the home or in one of our community clinics.
Excellent. That's very good. Can you bend it up one more time?
The help I've had from occupational and physiotherapy is that they've made sure Alan has everything that he's needed to be able to stay at home. For example, he has a medical bed. He's got a pole in his bedroom to help him get in and out of bed. He's got a special bench in the bathroom for him to sit on when he has his shower.
Oh, every part of it helps me stay at home because I've got easy ways of getting up and down and in and out, and I'm always grateful for them.
Over the next several months following discharge from hospital, the case manager will continue to assess the situation at home to make sure that home supports are adequate and the patient is still living safely in the home.
Okay, Alan, you're going to sit up. Okay, yeah, you want to sit up a little bit more? Pull your chair up. That looks really good. So we're going to transfer into this chair. Okay, put the brakes on.
If at any time it appears that more services are required, or that possibly admission to a residential facility is necessary, then the case manager will do that assessment in the home.
Feet nicely on the floor. All right, do you think you need to come up a little bit more?
I think so.
Yeah, you all right?
We help our clients who are in the community access services that they need in order to live at home for as long as they can, as independently as they can. And that's what we do. And that's why home is better for our clients who want to be at home.
So my name is Katie DeGeis. I'm a case manager with New Westminster Home Health. I have a caseload of 75 clients, and Norman Parker is one of my clients.
I don't want to live in residential care because I don't want anybody else looking after me. I look after myself. I don't do a good job of it, but hey, I still look after myself.
So I met Norman about 3 years ago when I started in case management, and at that time he had just come out of Queen's Park following a fractured hip. His last admission was related to fluid on his lungs, and he was kept for about 3 weeks. He's been discharged home since with his home supports once more in place.
I was told to go to long-term care. I did look after me. But I figured long-term care takes away my independence. I'm used to being independent.
So Norman receives 92 hours of home support. So the Bayshore workers come in 4 times a day, every day of the week. They help Norman with his medications, they help Norman with his meal preparation, and they help Norman with his catheter care. Norman has a very supportive family. He has 3 sons, Shane, Chris, and Rick. Shane and Chris take him grocery shopping, they come around, they help him with his housework. If he has any appointments that he has to keep, then they will take him to the appointments.
Chris does my grocery shopping for me. He does my vacuuming for me. So he knows I can't do it, so he does it for me. It bothers him that my floor gets dirty, so he does it for me. Either Chris or Shane, usually just Chris.
We absolutely need to support the family members that take such an active role in caring for their loved ones. In many situations, without them, it's really difficult to support independent living, keeping our seniors in the home. So with home health, we do provide respite, recognizing that family members need regular breaks in order to carry on doing what they're doing.
I think that respite is extremely necessary so that you don't get overtired and keep up your spirit as well, because otherwise it would be just too much for a person to look after all the time.
We know that our senior patients want to get home as soon as possible. They want to get back into their own surroundings. They don't like being in an unfamiliar institution. There are times, though, that families are feeling a bit insecure about having their loved ones discharged back home. That's when we can sit down with the families and go through the services that we can provide directly from home health, as well as the community services that are available.
And Marion was 71.
Day programs for older adults is another wonderful service that's provided through home health. It's a program where our seniors, who are often very isolated living in their own homes in the community, can attend 1 to 2 days per week. Each day is about 5 to 7 hours long. It's a therapeutic environment with programs that stimulate the mind and the body, where seniors have the ability to participate in functional activities like cooking, baking, doing arts and crafts, and playing games.
Just let it drip a little bit. Okay, turning into the first cupcake. That's okay. You got it. Got it. Good. Okay.
The health professionals that work in the day programs are nurses, LPNs, and recreational care aides and therapists. They can provide assistance with the programs that run at the centers, and they also can provide some health monitoring, such as blood pressure monitoring or glucometer checks for our diabetic clients. A very important benefit of the day program is its ability to provide a day of respite, a day of rest for the family members who provide care for their loved ones. Knowing that their spouse or their elderly parent is in a caring, therapeutic environment for the day gives them a peace of mind, allowing them to have a day of rest in their home and attend to their personal needs. We believe living at home as long as possible with the help of home health and community support services is a far better option for our seniors than moving into a residential facility. It allows them to stay connected with their families, their friends, their neighborhoods.
Oh, that's really nice.
They had all nice pictures of her when she was a baby.
We believe that a major life-changing event such as moving into a care facility should be a decision that's made during a period of wellness and stable health, not during hospitalization and not when one is recovering from illness. We want to respect the wishes of our seniors who tell us that they want to live at home as long as possible, and we are working to improve our services and to add more services to help our clients with their function and to support their independence and to improve their quality of life. We also want to give their families respite or a period of rest so that they can continue to care for their loved ones for as long as possible.
I think it's wonderful to be able to have a person who needs to be looked after to be at home, where he's among the things that he knows, where he can get up and go to bed when he wants to watch television, listen to music, or whatever it is, because he's far more comfortable at home than he would be in the nursing home.
I feel very good actually living at home, and with my age, and I need to feel, secure. So living at home gives me that feeling.
I like being on the go whenever I want to. I started when I was 15, and I haven't quit.
We're here in the community to support our seniors and their families, to help them continue to age in their homes.